So I'd like to talk to you a little bit about the Tibial Plateau Leveling Osteotomy, or TPLO. It is what most surgeons think is the best option we have for canine ACL tears. My own dog's had a TPLO, and if she tore her other ACL tomorrow, without a doubt, she'd get a TPLO. But I'd like to go over kind of point by point why we think that it's the best option. And if you've watched the previous ACL discussion here on our website, you might find a little of this redundant, but we're going to start with anatomy. And so an anatomic illustration is here on the computer screen, and we see the femur above the joint, the tibia below the joint, the ACL connecting the two bones, and the top of the tibia is the tibial plateau. That sloping tibial plateau is a key anatomic point of why we think the TPLO makes the most sense for ACL repairs. And here we see the same orientation, a radiographic image, and again, femur above the joint, tibia below the joint, and the downward, backward sloping tibial plateau, different than a human. And so that anatomic point is key. And I actually have my knee scrubs on today, and I'd like to illustrate the same point on my knee scrubs. So on this side of my scrubs is a human knee with a level tibial plateau. And so the way that a human tears their ACL is a football player hits from behind the tibia thrusts forward and tears the ACL. On the other hand, on a canine knee or stifle joint, the weight bearing slides down and back, down and back, down and back, which stresses and stresses and stresses and ultimately tears or causes the biomechanical breakdown of the ACL. And I have that in another image here. And so this is same artist illustration, represents that downward, backward sliding motion that results in the torn ACL. One other way to illustrate is with a set of x-rays that we have. So in this patient, during weight bearing, the femur slides down and back, and that downward, backward sliding motion is what tears the ACL. It's what creates the chronic biomechanical stress on the ACL, and it dictates a lot of things. It dictates how dogs tear their ACLs, because they usually do it little by little by little with this biomechanical degeneration. It dictates why they need repair. It dictates why most surgeons have abandoned old style repairs, and it dictates why we do tibial plateau levelings because of that problem. Now, that chronic biomechanical wear and tear leads to this chronic breakdown of the ACL that we see in dogs. And I have 4 little clips of arthroscopic videos that show that. And so the first is a normal ACL with nice tight bundles of fibers. But next we show one that's starting to degenerate. The fibers are becoming loose, discolored. If we push on them with a probe, we find that the ligament appears soft. And this ligament will gradually start to fray and end up looking like this patient, where there's actual filaments of the fibers that have torn. That gradually progresses to a full ACL tear, where the fibers are completely pulled apart. We see hemorrhage within the joint, and that is the end result of this chronic biomechanical wear and tear. That whole concept of how ACLs tear in dogs, it really dictates a lot of how we repair them. In many cases, we'll see a canine patient that is very, very lame, but does not have joint instability. The ligament's in some tearing process, some degenerate process. The joint is chronically inflamed. The joint is chronically painful. They limp in some cases continuously. But when we look with an arthroscope, they have quite a bit of normal appearing ligament left. And in the past, before TPLOs were available, we would put in some type of stabilizing replacement technique, some big suture, fishing line, or some other material to stabilize the joint. But the joint's not unstable. It is just biomechanically pulling and stressing the ACL. And we know from thousands and thousands of replacement techniques that we've done over many, many years that when you do the replacement, the stability that you have at that moment is gone after a couple weeks. The material stretch, the anchoring points subside, the soft tissues loosen, and so the stability is not great. And so many of us have the thought that to do a stabilizing replacement technique in a joint that's not yet unstable makes no sense. What does make sense in one of these gradations of partial tears is to change the biomechanics so the ligament that's left isn't chronically being stressed. And so that's one major point of how the mechanism and how a canine ACL tears has influenced us in how we do the repair. The tibial plateau leveling osteotomy is the most commonly performed surgery in veterinary orthopedics, and we're going to walk through step by step how it's performed. And the first part of it is the diagnosis. And the diagnosis is based on physical examination, clinical signs, and x-rays. And on x-rays, you cannot see the actually torn ACL, but you can see signs that are representative of that. And I've got an x-ray here to show you. And what we see is fluid accumulation and or scar tissue within the joint that shows up as a gray mass effect in the joint. We see the bone spurs on the end of the patella very commonly. Those bone spurs are not causing a problem, but they're a sign that the joint's chronically inflamed, and 99% of chronically inflamed canine stifle joints have ACL disease. We also see that the femur is slid back on the tibial plateau. Now, in the previous illustration, we saw in a complete ACL tear where the femur can slide all the way off of the back, but that's not typically what we see on an x-ray. So the x-ray, in most cases, is suggestive, but not definitive for the diagnosis. And the definitive diagnosis comes with arthroscopy, which happens at the beginning of surgery in the operating room. So once we're to the point that we feel that this patient almost for sure has an ACL tear, we move to general anesthesia. And general anesthetics these days are extremely safe. Once the patient's under general anesthesia, we then do a morphine epidural. So it's a local morphine effect that deadens the nerves that go to the knee. It allows us to use less anesthetic, and it allows our patients to wake up comfortably enough to go home on the day of surgery. Once the epidural's completed, we take very specific x-rays under anesthesia to make measurements and do some preoperative planning on exactly how we're going to do the TPLO. We then shave or clip the leg from hip to ankle and move into the operating room. Prep the leg with an iodine solution, put drapes around the leg so we only have a sterile field to work within, and then we start with arthroscopy. And arthroscopy involves a small poke hole and then a scope inserted into the joint, and then a view on the TV monitor to inspect all the structures in the joint, make 100% sure of our diagnosis, make sure there's no meniscal pathology, and evaluate the overall cartilage health for osteoarthritis at that point. And I have several arthroscopic videos to show. The first is a normal ACL, and in this case, we're probing the normal ACL. We see nice blood vessels within it. The fibers are nice and tight, the ligament's tight. We see its base of insertion there. And then we'll look here at the posterior cruciate ligament, which almost never is involved in canine stifle disease. And again, this nice broad base of attachment of the ACL. So it's quite a large ligament. That's what an intact ligament looks like. Next, we'll look at one that is torn, and here we see the ligament that has pulled apart, almost like a mop head being pulled apart, with large and small fibers, with hemorrhage within the joint, and this represents a full, complete ACL tear. Once we've made a definitive diagnosis, then we move ahead with the Tibial Plateau Leveling Osteotomy, or TPLO. And I'm going to walk through that with you step by step. But before we do that, I'd like to give you an overview of the procedure. So this is the illustration that we've seen numerous times throughout this presentation. And during weight bearing, we see the femur slide down and back, tearing the ACL. The surgical procedure involves making a curved bone cut in the tibia and rotating the top section until the tibial plateau's level, then securing that section with a bone plate. The bone heals wonderfully, like it was never cut. The bone plate becomes obsolete after months, but we usually don't feel it's necessary to remove it. So that's an overview. I'd like to walk you through kind of how this goes step by step. So once the patient's in the operating room, the leg's draped in, we make a small surgical approach to the medial side or inner side of the tibia. And I'm going to use my plastic model illustrations again. And so there's a small surgical approach made. It's in an average size lab. It would be 4 to 5 inches. Once we make the surgical approach to the bone, we're then ready to proceed with making our cut and doing the rotation. Most surgeons use a device called a jig. And the jig is placed on the leg using small pins to hold it in position. And the purpose of the jig is, once we've made our cut, is to hold the bone in appropriate alignment. Not all surgeons use a jig. I do, but it's personal preference. So once we have the jig in place, then we'll use an oscillating saw. And we have a variety of these saw blades, and in fact we have about 10 different sizes, and we can place them appropriately on the bone, and they just vibrate and oscillate in a fine motion to make a very precise cut. So that's what the next model shows, is that's what we've done. We've performed the osteotomy, and you can see that's where the osteotomy was performed, and we see that section of bone now we can rotate. So based on preoperative measurements, we rotate it an appropriate amount, and then with it in that new level position, we fix it in place with a bone plate. And bone plates come in a variety of sizes and shapes, and also in about 10 different sizes and shapes. They're made of either surgical stainless steel, which is most common, which is what this plate is, or of titanium. And then there's some other really unique factors that are coming into play with today's bone plating technology. And one is locking screws. This has been a big advancement in veterinary orthopedics in general and human orthopedics, but very specifically with the tibial plateau leveling. And so the way that this screw works is this screw has threads on its head. And then of course it has threads that engage the bone. So as we put the screw in and tighten it, it will go into the bone, but then it also tightens into the plate, and it secures into the plate. So it's very rigid. And it's called locking plate technology, and it improves immediate postoperative comfort. It improves the time to healing, and it's been a great innovation. So that's the plate that we put on. And I have the final model that shows the plate in place with the rotated top segment, and that's what the final product looks like. We'd be looking at that much of it through the surgical approach. Once we're there, we test for joint stability and make sure that thrusting motion that we've illustrated before is gone, and then close the incision. And the incision's closed with buried sutures that do not need removal. And from there, we move into X-ray and take an X-ray to make sure, or radiograph, to make sure that the placement of the plate is correct and the tibial plateau's level. And I have an illustration of that. So We move to the x-ray, and here we have an example of a level tibial plateau. We actually shoot for about 5 degrees, but a relatively level tibial plateau with the bone plate in place. Our patients go home the day of surgery, usually about 2 hours after surgery, and the night of surgery, they're very comfortable because of the epidural, but they're very sleepy. So most go home, find their favorite spot to sleep, and go to bed for the night. And most sleep through the night. Some go home, and if they're a typical lab, they want to have a half a dinner before they go to bed. But in general, they're very comfortable. We do have here at CCO a 24/7 ICU, but as a dog lover, I think most dogs are happier at home, and the epidural allows us to do that. The next morning, again, if it's a 2-year-old lab, they're probably looking for their tennis ball, and so they make a remarkable improvement over the first 12 to 24 hours. But older dogs are not completely themselves for a day or two, but by 72 hours, virtually all the patients are back to their same level of energy, personality's back. They're still limping, but overall doing well. They do wear the cone of shame for about a week so that they won't lick their skin incision, but that is usually not a really big problem. And in those weeks after surgery, they are most happy to be on some form of pain meds, and we really use 2 things. We use an anti-inflammatory drug. Rimadyl, the most common example. And many patients are happiest to be on that for up to 6 weeks, but it's variable. We also use a non-narcotic pain reliever, most commonly tramadol, which we would use for approximately 10 days. During the healing phase, and the TPLO takes approximately 12 weeks for the bone to heal all the way, but it heals wonderfully. And it's a very strong fix, so during those 12 weeks, your pet can have reasonable activity. And by that I mean short leash walks, and we usually increase those a little bit week by week by week. They can have reasonable house activity. That means they can move around on a single level floor as long as the footing is good, but they shouldn't get to run up and down stairs. And so the restriction is not ridiculous, but it is important that we not allow them to overdo it. I mean, chasing a squirrel in the backyard 3 weeks after surgery would be a definite problem or a definite no-no on you and your dog's part. But it is a very strong fix. It's not fragile. Seldom do we ever have a problem where a screw breaks or an implant breaks. So the post-operative period's not bad. It is a change of lifestyle if you have a doggy door, because they can't go through the doggy door and out to chase the squirrel. Again, the bone healing is a two-edged sword. It takes longer to heal than soft tissues, but it is the strongest healing tissue in the body. Almost all soft tissues, skin, muscle, tendon, heals with a little weld of scar tissue. Bone actually grows bone across where the cut's been made and goes back to full original strength, but it takes about 3 months. So here we have an x-ray of what it looks like once the bone has completely healed. And here we see that where the previous cut was made has just filled in with a nice S shape of bone. There's no evidence of the previous cut at all. But that does take about 3 months. At that point, animals can return to full normal activity. And we have one of our patients, and this is a very representative example, but we have one of our patients out about 3 or 4 months chasing the ball in the backyard. And so this patient's actually had 2 TPLOs, and as you can see is doing great. And again, that is a representative example, not just one that we picked. Overall, 95% of our clients are thrilled with how their dog does. The 5% that aren't, they're still a lot better. They're just not back to the level that we had hoped. You know, the most common reason for that and the most common postoperative problem that we see is osteoarthritis. Almost all humans or dogs that tear their ACL will develop some degree of osteoarthritis. The majority of dogs that we see, by the time we see them and scope them, they already have some degree of osteoarthritis. We think that the TPLO is the best procedure to minimize the progression of osteoarthritis, but I still think that to some degree it continues to progress. So that's the main problem that we see in dogs that have torn their ACLs, and of that 5% that say, boy, they're not as good as I'd hoped, that's usually the reason. In conclusion, I'd like to leave you with a couple of thoughts. One is that dogs that tear their ACLs or are tearing their ACLs really do need surgical repair. And none of us want to have their pet have surgery. I have 3 dogs, they're like my kids, so I understand that completely. But ACL tears in dogs are almost always progressively debilitating, so they really do need repair. The good news is it's a correctable problem with really consistent positive results. So if your dog has an ACL tear or you think might have an ACL tear, we'd love to be able to help and get them back to the ability to chase the ball in the backyard. Thank you.